What are the criteria for surgical drain removal? Imagine having a small tube in your body after surgery. It's there to help your healing process by draining excess fluid. But when is the right time to take it out? That's what we're here to find out. First, the amount of fluid draining is a big factor. Usually, if the drain is collecting less than about 30 to 50 milliliters of fluid each day, it might be time to consider removal. Surgeons look for a consistent decrease over several days, which shows your body is healing well and not producing too much fluid anymore. Next, the quality of the fluid matters. When you first have a drain, the fluid might look red and blood-tinged. As you heal, it should turn pink and then clear or watery. If the fluid stays bright red or turns greenish or smells bad, it could mean bleeding or infection. In those cases, the doctor might decide to keep the drain in longer until those issues are under control. Another important point is how much time has passed since your surgery. Many doctors prefer to remove drains after 1 to 3 days if the fluid output is low enough. Removing drains too early can sometimes cause fluid buildup, but waiting too long might increase the risk of infection or discomfort. Studies show that removing drains based on time can help reduce blood loss and shorten hospital stays without raising infection risks. Your overall healing progress is also checked. The surgical site should look good, with no signs of infection like redness, swelling, or warmth. The area around the drain exit site should be clean and dry. If everything looks normal and you're healing well, the doctor might decide it's safe to remove the drain. The surgical team will assess all these factors together. They might also analyze the fluid if infection is suspected, to check for bacteria or other signs of trouble. When it's time to remove the drain, they usually do it gently by loosening any stitches and pulling it out smoothly. You might feel a little discomfort, but it's usually quick and not too painful. Afterward, a sterile dressing is placed to prevent infection and help the area heal. Once the drain is out, you'll be given instructions on how to care for the site. Keep an eye out for increased drainage, foul smell, or pain, and report these to your healthcare provider. In summary, drains are removed when the fluid is low and decreasing, the fluid looks normal, enough time has passed, and your healing is on track. The medical team carefully watches these signs to decide the best moment for safe removal.